Psoriasis and psoriatic arthritis don't just affect your skin or joints. They can increase your risk of heart attacks and strokes as well. But there's good news. You can reduce that risk starting today. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. If you or someone you love has psoriasis or psoriatic arthritis, you're probably already dealing with flares, joint stiffness, and sometimes even fatigue. But did you know you also face a higher risk for serious heart and blood vessel conditions? What makes this risk even more alarming is that it goes often unrecognized by patients and sometimes even healthcare providers. Today, I'll break down exactly what the research says, why this happens, and most importantly, what you can do about it. Let's begin with the big picture. Both psoriasis and psoriatic arthritis are systemic inflammatory diseases, not just skin or joint conditions. That chronic inflammation affects your entire body, including your blood vessels and heart. Here are some key studies to keep in mind. Article from JAMA in 2006 showed that young patients with severe psoriasis had an increased risk of myocardial infarction or heart attacks, even after adjusting for traditional risk factors. The KARIMA study, published in 2012, found that endothelial dysfunction, an early marker of atherosclerosis, was significantly higher in people with psoriasis, especially untreated moderate to severe disease. And a large 2018 meta-analysis published in Frontiers in Rheumatology confirmed that psoriasis is associated with higher rates of hypertension, diabetes, obesity, and cardiovascular events, especially in severe disease. These findings are consistent across over 20 population-based studies globally. Psoriatic arthritis brings additional complications. Compared to psoriasis alone, people with psoriatic arthritis have higher prevalence of insulin resistance, increased carotid intima media thickness, a marker of early vascular disease, and more coronary artery calcification seen on cardiac imaging. In a 2020 review from Current Rheumatology Reports, psoriatic arthritis patients had twice the risk of cardiovascular death compared to age-matched controls. That's not just statistical noise, that's clinically significant and demands attention. Here's what's actually happening inside your body. Chronic inflammation causes endothelial damage, making arteries less flexible. Increased LDL oxidation, which promotes plaque buildup in the arteries. Overactive platelets, raising the chance of clot formation. Your immune system, which is already in overdrive, sends inflammatory cytokines like TNF-alpha, interleukin-6, and interleukin-17 through the bloodstream. These molecules damage blood vessel walls and accelerate the development of atherosclerosis. Think of it like this. Instead of just attacking your joints or skin, that inflammation is silently attacking your heart and arteries. There are benefits to using disease-modifying treatment and biologics on heart health as well in patients with psoriasis and psoriatic arthritis. This is one of the most promising and active areas of psoriatic research. When we use medications that target inflammation, we're not only improving skin or joint symptoms, we're potentially protecting your heart as well. TNF blockers. A major 2018 meta-analysis in Scientific Reports show that TNF blockers reduce the risk of cardiovascular events in patients with psoriasis and psoriatic arthritis. TNF inhibitors further reduce C-reactive protein and improve endothelial function, which are factors directly linked to heart health. Interleukin-17 and interleukin-23 inhibitors are newer biologics that have shown promise in reducing vascular inflammation as well. A study in Circulation, published in 2019, found that interleukin-17 blockade reduced vascular inflammation on PET-CT scan in psoriasis patients. In rheumatoid arthritis, methotrexate use has been linked with a 21% lower cardiovascular mortality in a study published in Circulation. Although data in psoriatic arthritis is more limited with that medication, some studies suggest that methotrexate may offer similar cardiovascular protection when disease is well controlled. Now let's talk about your role in reducing risk. What can you do preventatively? First off, know your numbers. You need to know your blood pressure, your LDL, HDL cholesterol, your hemoglobin A1C, or fasting glucose number. Ask your doctor to use tools like the Q-Risk3 calculator, which includes inflammatory diseases in its prediction model. Lifestyle adjustments are key. An anti-inflammatory diet, think of a Mediterranean diet rich in leafy greens, fatty fish, nuts, and olive oil. Make sure to exercise. Aim for 150 minutes per week of moderate activity. And sleep and stress is important. Chronic stress can worsen inflammation. Prioritize your mental health and recovery. When it comes to medication, don't ignore mild psoriatic arthritis and psoriasis symptoms. Do not delay treatment for those conditions. Don't rely on topical creams alone. If your disease is systemic, your treatment should be too. Now let's talk about some common misconceptions and debunk them. First off, my skin's clear, so I'm not at risk, right? That's not quite right. Even with clear skin, systemic inflammation can persist if joints are involved or the disease is smoldering under the surface. Number two, I'm too young to worry about heart disease. Most people with psoriasis or psoriatic arthritis are diagnosed before the age of 50. Cardiovascular events can start as early as the 30s in people with chronic inflammation. Number three, if I take medication, I do not need to exercise or eat healthy. That is incorrect. The best outcomes come from combining medical treatment with appropriate lifestyle changes. So let's wrap up what we've covered. Psoriasis and psoriatic arthritis dramatically increase your risk of cardiovascular disease, even if you feel fine. Chronic inflammation is a driver, but the right combination of medication, lifestyle, and awareness can significantly reduce your risk. If you found this video helpful, please like, subscribe, and share with someone who might benefit. For more content on non-surgical solutions for pain and inflammation, visit us at chicagoarthritis.com. If you're concerned about your cardiovascular risk and have psoriasis or psoriatic arthritis, do not wait, reach out. We'll work together on a personalized plan that treats the root of the problem and protects your long-term health. Until next time, stay healthy and live well.